Okay, let me just tell you a little bit about myself. I have been in clinical research for several decades. I started out as a coordinator in academia in New York City, where I am positioned right now. I then transitioned to industry and had positions starting out as a monitor, site selection specialist, which was one of my favorite positions, study manager, and then quality roles. And now what I'm doing is I'm an independent consultant, and I specialize in training. So kind of where I like to be right now. And so we just have a little get-to-know-you kind of session here. We're going to talk about subject recruitment, proactive project plans, and issue management. Okay, we have lots of objectives today. We're going to explore updates on the clinical trial participant recruitment worldwide, discuss an overview of participant recruitment practices, including use of social media, which is becoming more and more used today in our subject recruitment, which is kind of a double-edged sword. We'll talk about that as well. We're going to look at also the keys to success, systematic practice approaches to recruitment in clinical trials. We're going to employ pre-screen practices to improve screening successes, and then examine the consenting process in regard to subject recruitment and retention. We're also going to determine approaches to retain quality subjects to support data integrity. We know that recruiting subjects is difficult enough, but we also want to make sure recruiting the right kind of subject and that they're going to stay in the study at least for the long term. Obviously, any subject can discontinue their participation at any given point in time for any reason, but hopefully through the proper screening process, we're not having people drop because they didn't quite understand what they were getting into. So we'll take a look at that as well and retaining the subjects. And then evaluate efforts, the recruitment report card, so to speak. Let's look at the state of the industry in terms of the clinical trial participant recruitment. Okay, right now you just mentioned something, Jennifer, in terms of your patients being very educated. It is true. Patients more and more now, especially with people going onto Google and going onto the web, MD or what have you, they're finding out information about their particular disease, about particular treatments that are available, and they're coming in and they're really very knowledgeable. And that's a good thing, actually. But again, you do face that problem that if there is an approved medication out there or an approved device that they can use, and they don't want to take the chance on a clinical trial of something that's unknown and unproven at this point, that can lead to some problems. So it is more challenging, no doubt about it. There's more challenging if there's something out there already. So having said that, we do want to acknowledge that a lot of patients are coming in with a lot of information already. And we want to welcome that dialogue. We want to make sure the sites are talking to the patients about their condition, about the options. And of course, in their informed consent, they're going to be given the option, not the option, but to be told that there are alternate treatments. That's something we're mandated to do in our informed consents. So again, overall, the number of clinical trials continues to rise. We know that we have fewer investigators, but more trials, and they're much more complex than they used to be, making it much more harder to get patients in and recruit them for these studies. So approximately only 10% of all sites meet their enrollment marks. This comes out of a Tufts Center Watch study, actually. So 10% of all sites meet their enrollment marks. That's pretty low. It used to be actually even a little bit lower. I think it was like 7% in the past. So again, you go out there with this idea of, hey, we want to roll out this protocol. We want to have all the enrollment completed within 6 months or what have you, and you're finding that it's becoming longer and longer. You have some sites that will not enroll anybody, and you spend all this money to get a site started up. The site also spends all their resources in terms of sending people to investigator meetings, submitting to IRB and so on, and then there are no patients. So it's like a lose-lose in that situation. So we want to make sure that we really have a robust system for site assessment and really some careful thought that going into our protocols, that we are checking feasibility as much as we can up front. Now, here's another statistic for you. Further out the site goes without enrollment, the less likely to enroll. So, everybody's real excited in the beginning. They want to enroll. They start looking for patients. 1 month passes, 2 months passes, can't find anyone, or no one, or maybe you have a very high screen fail rate. And it becomes less likely for them to enroll. What's happening? They have other studies going on. Their efforts are going to be, their excitement, shall we say, is now maybe with another study or some other studies, plural. Okay, so most enrollment targets are either not met or delayed in trials, and it's due to difficulties finding the qualified volunteers. And again, we need to look at our protocol to see, is it a problem with the protocol, or is it just really a very tough, maybe we have a disease that's not so prevalent, so it's very tough to find these subjects. So sometimes even just modest little tweaks to our process can yield really good results.